It's bad. And let me tell you guys, and again, I know y'all like, we can't look at the numbers, everything's doing better. Yeah, bitch, it's doing better now. Let's just see what it's just gonna be in a month. Now, I know all the rest of y'all, the whole world has moved on from COVID. COVID, what's COVID? That's just like a little flu. That was a little flu. No, y'all, we have been dealing with a worldwide pandemic since approximately March of 2020. It has affected each and every single one of us, each and every single one of us in ways big and small, especially those who have tragically lost their lives to COVID, which, by the way, we have lost over 1 million people. I know the CDC's official number is 954,000 around roundabouts, but I know here on this program we have talked about the reasons why I think that number is bullshit. If you go to the first, let's say, 6 to 9 months of the pandemic and you follow what was happening in Florida, what was happening in New York State, and what I imagine was happening in a lot of other places, many other states across the country, COVID deaths were not being counted as COVID, right? They were being attributed or listed on death certificates as deaths of other causes. But ultimately, a lot of people died of COVID, and a lot more than what has been reported. Even some studies estimate that perhaps we might have lost millions of people to COVID. Um, so there is that. And I don't think that, number one, that this country has taken the time to fully acknowledge the mass trauma, the mass grief that we all have endured. Whether or not you knew anyone who died from COVID or no, um, lots of people got sick. I think we have 75 million COVID infections. And that is where we're going to start, guys, because despite the fact that the United States leads the world with total COVID infections and total COVID deaths, across the country, we are seeing indoor masking mandates fall one by one. In a lot of public schools, it is mask optional. And, you know, the whiny, whiny white folks who, who are in a trucker convoy headed to DC right now for tonight's State of the Union address. When we reach a critical mass of white folks who are dissatisfied, who won't hesitate to organize, and who are just very comfortable being a very loud relative minority, shit changes, okay? And the shit has changed. Now, the problem is we are at a lull in this pandemic, at least the United States. If you think that COVID is over, I ask you, where is the evidence? And if you point to falling hospitalizations and falling case numbers, yeah, you could say that. But guess what? We've been there before. I'm trying to figure out where I want to start with y'all because there's a couple of things that's really troubling me about this. Um, because the way that this is being covered is bothering me, and the way that our elected officials, our public health officials, are all falling in lockstep with with the corporate desires, right? With capitalist desires that people return to work, that everybody is back to normal, even though normal was extremely fucked up. Except beyond the end result that we are still experiencing of COVID, now we're dealing with a war. Now we're dealing with record inflation, and all these things cascading effect on the collective mental health, I believe, of this country. Let's take a look, if we could, today. Let's take a look at C1. So, guys, as the masks come off, and I know in this country we can't remember shit, which is why, our education system is so bad, which is why Americans have a difficult time at shit like history to begin with, because we can't remember what happened last fucking month. Um, this is from last month. This week, COVID death toll hits its highest level in about a year, rising 39% over the past 2 weeks, according to data compiled by Johns Hopkins University. Though the highly contagious Omicron variant is generally produces milder infections, which again, milder infections, says whom? Says whom? We were dealing with record COVID deaths not a month, just a month ago, guys. It's pretty ridiculous. We had a number of hospitals across the country engaging in crisis standards of care where they were managing care, meaning that they would deny care to usually disabled people or immunocompromised people in order to provide better care to alleged healthier people or people who had more normal health diagnoses, right? And in February, the US hit its COVID death toll at its highest level in about a year, 39% over the past 2 weeks. And sending our hospitals and our public health workers into a lot of distress. And we have been dealing with only since recently, like literally like the past 2 or 3 weeks, y'all, we were rocking at 2,400 COVID deaths a day. A day. That was a month ago. They telling people that they can go inside without masks today. Y'all, the fucking day. And last month, we were at our highest death toll throughout the pandemic. 2021 was worse in this country for COVID infections and COVID deaths than 2020. Yeah, it's bad. And let me tell you guys, and again, I know y'all like, well, Kim, look at the numbers. Everything's doing better. Yeah, bitch, it's doing better now. Just see what it's just going to be in a month. Because the reporting around COVID is also getting way sketchier. Way sketchier. And let me just show you guys a couple of quick clips to kind of illustrate what I'm talking about here. So, Tunde, let's take a look. It's going to be C3, and then we'll play C4. But I'll take a break from C3 to C4. But you guys, so Johns Hopkins University, one of the leading research hospitals, and blah, blah, blah. Okay. Hopkins is not a good steward of East Baltimore, so Marylanders sometimes look at Johns Hopkins as being very, you niggas are sketchy, a little sketchy over there at Hopkins, but okay. But Hopkins was taking the pulse, basically, keeping track of all the numbers, not just in the U.S., but worldwide. And I want you guys to look at this clip of March 1st, 2021, of Johns Hopkins CODA data tracking. It's a 1 minute long clip. I'm sorry for our visually impaired people because Johns Hopkins apparently are a bunch of assholes that they did not put any words into this. They just flashed a bunch of numbers, so I apologize for that. But I want you guys to take a look at this, and then we're going to look at this exact same YouTube channel for today's date, March 1st, 2022. But first, let's take a look at where COVID was March 1st, 2021. And I want you guys, okay, yeah, let's just look at this shit, and then I'll tell y'all what y'all need to look out for. Look at this. Check this out. Okie dokie. So you saw about a year ago, it wasn't doing all that great COVID wise. We had cases in the tens of thousands every day. We had thousands of people dying daily, right? Okay, so let's take a look at March 1st, 2022. Now, for context and to be fair, I will be fair. So let's to be fair. So March 1st, 2021, the widespread availability of vaccines was just beginning to happen. The vaccine rollout was underway. I think this week last year, the J&J shot was awaiting FDA approval, and perhaps Pfizer, Moderna had been available for just a relatively short amount of time. So I'm going to give that context to be fair. But I want y'all to take a look at what Johns Hopkins put out regarding March 1st, 2022. And I want you guys to tell me if you notice anything missing. Let's take a look. So I believe that Johns Hopkins is clearly trying to emphasize the vaccine progress, the vaccination progress. But what I didn't see as clearly notated as it was a year prior were the number of COVID deaths per day, the number of COVID infections. It gave it, but you better been watching. And if you can't see that, I guess Johns Hopkins didn't really want you to have that information, which is extremely fucked up when it comes to the accessibility of COVID information. Johns Hopkins, shame on you assholes. You need to make your content accessible for everyone. Guys, we are having a big problem. I don't know. We are about to be dealing with this pandemic literally with both arms tied behind our backs and blindfolded, because there seems to be a big reluctance coming from national public health entities like the CDC. Or let me put it to you this way. They got the information on their website. They don't make it necessarily easy for you to find. They are the CDC.gov. If you go to their COVID portal, they will ask you your state and county, and they'll tell you what the COVID rates are looking like in that given state and county. But when reporting nationwide numbers, you really have to dig for them, and it's not easily findable. And what troubles me the most about this, guys, is that this is not the first lull that we have experienced in this pandemic, but we are acting every time we have one of these major dips in new COVID infections. We act like the shit is over, like the shit is done. Hooray! It's finished. What I don't know what part about COVID is indicative that this is finished, right? And if anything, we probably have even a little bit more to fear from the fact that we know now, a year on, that vaccines do not prevent COVID transmission, right? You can still catch COVID and be double vaxxed and boosted. You can even still die from COVID if you were double vaxxed and boosted. And that is, y'all, that I'm not hearing enough of those stories. And I don't know to what extent that this is this something that we should be concerned about as the effectiveness, the vaccine efficacy wears off? I mean, they're already talking about ongoing boosters in perpetuity. I don't know how I feel about that, but at the same time, I don't want to die from COVID because that shit looks like amongst the worst terrible deaths that you could probably have. I mean, suffocating. I mean, shit, you might as well drown. Like it's not good. It's a bad way to go, right? It's a bad way to go. But I'm concerned that for one, kids under 5 are not eligible for a vaccine. So what do we tell? What are y'all telling y'all preschoolers and y'all toddlers? Good luck, little buddies. Try not to let Susie cough on you today in school. Because you're supposed to be going to grandmommy's this weekend, and you know grandmommy got diabetes, and she can't be getting. You understand? Like to me, there's a lot of incompletes regarding this COVID story, right? So we have kids under 5 and not can't get vaccinated. The new report out, I think it was yesterday, said that the vaccine was a Pfizer. I think it was the Pfizer vaccine for kids 5 to 11 shows that it has waning efficacy, right? I think 6 months on, the efficacy goes down to like 12% protection, even though they're trying to say that it does prevent kids from getting hospitalized. Again, I'm not an epidemiologist. I can't speak to this shit authoritatively, but it sounds as though children in America, ages 11 and under, may be more susceptible to this, despite their relatively low rates of supposed infection. But at the same time, we understand that long COVID is absolutely a thing. And I hope it's a thing that our medical community is trying to get its arms around, because with 75 million infections in the United States, and let's say about 1 million people died. So we have 74 million people, roundabouts roughly, who presumably survived a COVID infection. And out of those, we're thinking, what, 30% of people who have tested positive for COVID have reported symptoms of long COVID. Okay. Long COVID is it's a bad thing just because it's so new and so relatively unstudied. Like, y'all, I mean, I'm 43, right? Patch me getting COVID. And then I'm 50 and I got a heart condition. Why? Because COVID ravaged my heart and I didn't even know about it. It ravaged my lungs. I didn't even know. COVID gave me such terrible brain fog that I have been rendered less than productive, right? And that is also another thing that I want us to get into as we lift all these masking mandates and throw caution to the wind. Things are going back to normal, but we are still in the middle of a mass disability event, okay? People who catch relatively mild cases of COVID, again, can be stuck with dealing with long COVID. If you could pop up C2 for me there, Tunde. So the story that we are going to have to face here as a country, because we are in a pandemic and we live in a country with no real social safety net, no universal health care. Our kids don't have access to good health care, especially if you are working class or poor. But this comes from someone who is not poor. This is a lawsuit that is being filed by a COVID long hauler suing their insurance company for denying them disability. Okay, and this is a person of privilege. Let me read this to you from CNBC. No, this is from Bloomberg Law. A software executive contracted COVID-19 in 2020. They have sued Reliance Standard Life Insurance Company for disability benefits, telling a federal judge in California that she's unable to work because of post-COVID symptoms, including asthma, chronic cough, and, quote, brain fog. The complaint filed Tuesday in U.S. District Court for the Central District of California is one of the first federal lawsuits seeking disability benefits based solely on post-COVID ailments under the Employee Retirement Income Security Act from the Labor Department. We're going to see a lot of this because there are people who have been suffering from long COVID who are being denied disability benefits. And y'all, what are people going to do? Right? So you have that, right? You have people who have already contracted COVID who are dealing with the long-term effects and who are literally unable to work, barely able to sometimes provide or take care of themselves, right? So we have a huge chunk of people, the millions of that, right? But we are throwing caution to the wind. We don't care how many more people will get COVID. Mask off. Wear masks in schools. You may or may not have to mask in businesses in which you patronize, right? So we are more people infected with COVID, probably more people dying, and more people becoming disabled. This in the face of no universal health care in America. So what does this what is post COVID going to look like? First of all, I don't even know what the end, like the official end of COVID looks like. I don't know what year that's happening, but I'm thinking 10, 20 years down the line, what does the COVID generation look like as they progress on in age, as they become middle-aged or elderly, right? I think it's going to be extremely bad. And it's all the more reason that we need to keep fighting and keep organizing for universal health care in the system. We need a single payer system in this country. And I think tonight, while we're watching the State of the Union, and God damn it, I guess I will watch the fucking State of the Union, even though I hate Joe Biden with a fucking passion. But we got to hold his feet to the fire and call out his lies and his bullshit as often as possible. And this is a big deal. Snack Panther, thank you so much. Thank you so much for your super chat support. Snack Panther says, this is going to be the shit. You said ish, but I say shit. It's my goddamn show. Snack Panther said, this is going to be the shit when all the people that got COVID are going to be considered, come on, pre-existing conditions. Snack Panther, you already know where it's going because it's already headed there, right? Some insurance companies don't even want to acknowledge the existence of long COVID, even though I did check out, was it Department of Labor or was it Health and Human Services? The government website where the American Disabilities Act lies, it lives, right? So the government acknowledges long COVID. Some insurance companies have not acknowledged long COVID. And when they have acknowledged it, as Stack Panther has astutely pointed out, they will say, well, we can't give you no insurance or no disability because you got all these pre-existing conditions. This is really bad. This is not good. Now, does Joe Biden have a plan for this? I doubt it. I doubt it. Because you know why? We are seeing our stimulus money, our universal health care money. Yeah, they sent that shit right to Ukraine, baby. Just like they had sent it for the previous 20 years to Afghanistan. Well, not necessarily to Afghanistan, but sent it to Afghanistan via Lockheed Martin and Raytheon and BAE Systems. Yeah, they sent it, through those intermediaries, the fucking warlords. But yeah, y'all, we are shipping all of our social safety net money abroad, overseas. And I'm curious, I'm not going to say they're not out there, but I have not been paying a lot of attention to the squad. Is there an anti-war bloc in the United States Congress? Have we seen a contingent of Congress people come out and say, hey, we oppose this war, period. We oppose American or NATO intervention in this escalation between Russia and the Ukraine? Is the anti-war contingent out there, or they just quiet? Or everybody's for the war? Oh, oh, I see. Now I know everybody ain't for the war. I'm sure Cory Bush ain't for the war, but I'm sure Cory Bush is being told to shut the whole fuck up right now because. Anyway.